and help standard bearer. I'm sorry, say standard bearer and vision bearer of the Kia Humanitarian Organization. And today is Sunday, and we're just waiting. I think.
Welcome in.
Let me
Quality
see.
of it. Oh, wait, no. And so very shortly we'll bring you the program.
Okay, let's go to a quick commercial.
This is Amazing Care Home Health Services. This is a home health agency. We send nurses and home health aides to patients' homes and take care of them, provide medical and non-medical services for them in their homes. So that's what we're doing. This is the office space where the how they call it, the high-end process is rendered.
Also the assisting admin at Amazing Care. I've been with this company since 2014 when we were making nothing. And we were literally in the basement of our apartment. This is how growth have brought us this far. 2-bedroom apartment, and we were literally using the basement and the garage space to carry on this business. And because of growth, we moved here on 2019, and we've been here since 2019 doing this. And God has been so faithful along the way, and we still going strong. You can see this is the office of Amazing Care. We want to welcome the Care Network in here.
Yeah, James, you got. James, can you hear me?
Yeah, I'm hearing you. Can you hear me?
Okay, yes, and thank you, guys. Those of you in Radio Land, and this is the conversation with the CEO. I'm sorry, and vision bearer of the Care Humanitarian Organization. We saw it, and it's not an easy thing to when it comes to technology. And today is Sunday, and we still on the topic healthcare. We still on the topic. There's an open mic, and we still asking you to make your contribution. We still asking for doctors or nurses or some hospital administrator or somebody to come on. You are free to come to the station anytime for us to discuss. And this is the show that come on every Sunday by 7 o'clock in Liberia and 2 o'clock in the United States. I'm not going to waste no time. I'm going to bring on my co-host and my brother and friend and Andrew Kia, who is sitting relaxing in his home and taking off his basic time. How are you this afternoon, brother?
Good afternoon, Mr. Kishan. Can you hear me?
Loud and clear. You are loud and clear.
Yeah. And to our viewers this afternoon, I know it's in the evening now in Liberia, around 7. We just want to welcome all of you on board as we all tap into our shared these concerns about health in our own country. It has been a very burning topic and a concern that we all discussing. A healthy society is a very productive society. All of us, we can never make plans. What we want to do for tomorrow. How does few years look like from now? All of that is contingent upon good health. Once you are well, you can do a lot of things. But when the health is troubled and the society is also troubled, it is a concern to everyone. So I want to welcome all of you on board. Let's do a trading of minds. Let's share ideas. Let's look at these issues in our society and see exactly what we can all put forward to our own government, put forward to our own people as to how we can keep our society safe. Thank you.
All right. Thank you very much. And Andrew, you said it all. And those of you who are listening, today we're going to have a nice show. Listen, we still begging you. We want you to share with us your concerns. What can we do? How can we fix it? What can the government do? We say this again. We are capable of taking doctors from anywhere. It still will not help Liberia because they don't know what is. You are the one who understand, who knows what is going on. You are the one going to the hospital to know what is going on, and the government can also tell us what is going on. Maybe there is no money, or yeah, we just say, "Oh, listen, we don't know, but you got to help us help." Here, Humanitarian Foundation is all feet to the fire. We got to hold everybody. We got to hold the citizens. We got to talk. We got to work together as a team. That's the only way we can get it right. We're not here to blame no one. We're not here to blame the government. We're not here to blame you. We're not here to blame ourselves. But as a team, when we come together, your little idea, my little idea, we'll put it together. Trust me, Liberia will be a better place for everyone. That is why we're going to open the lines very early today. We want to hear from you. This is not about politics. Don't wait and say, oh, because it's not politics, so I'm not going to call. And when you do that, then it's a problem. When you do that, it's a problem. Or you just want to hear them talking and criticizing government. We're not in the business to criticize government. And we'll say this again: this station has no loyalty to any political parties. We are not into politics. We want to be right in the middle of everything. But anything that concerns to like concerning Liberians or Liberia, we are willing to be part of it. So please have an open mind today and let us have a good show. Before I bring on our CEO and also the vision bearer, the man who is behind this whole thing, who he and his wife and his family, that they have to cut into their finances to say, listen, we got to give back to our people no matter what happens, whether we benefit or not, because it's a big liability, but we got to give back. How many of us, how many Liberians are prepared today to do this? Andrew, can you tell me how many Liberians prepared to do this? To say, to look at what you're supposed to take care of your family, and you cut into it and say, I am going to the last place to see how can what can I do? Can you
Trust
name
me.
how like things are prepared? How many of us prepare?
I mean, it's a challenge. You won't believe it. We have a society that I've lived in. I grew up into it and know it. I know ourselves. There is this adage of our own society: I, me, and myself. I think you heard that before.
Yeah.
And it's only it's a selfish perspective. It's that selfish nature where you have it and you can have it for you and your family. That's all to it. But it's so difficult to find few that will be able to give back to society. Everything you and I are doing today, the advocacy, making sure that the proper information reach our people, and even some of our own family members that are trying to do the best to giving back to say, I want to do this. It takes few to doing that. It takes just one people, people to doing that. And the vision bearer, like you rightly said, is one of such that I admire. He's my junior brother, but I'd be very frank with you. I respect him. I see what he's doing. I pray that more can be done and that we can all pave the way to see exactly how all of us can touch the lives of people. Those in the studio, those in those in radio land, to see exactly what we all can do to be of help to our own society. Trust me, when Liberia is fine tomorrow, woman, I am on my way back too to be of contribution further. Thank you.
Thank you very much. But before I come to the CEO and bring it up, and I know we're having a little internet problem, but I think it will be settled. And let me ask James. And James, you in Liberia, you in the studio. How was your day today? And I want to say thank you again for proxying for George. So what is going on out there before I bring out our CEO?
Yeah, so I'd like to say thank you to you, Mr. Kishe, and Mr. Kier, and the rest of the family there in the US for this great platform, which I think will help highlight or bring out issues that affect our health sector, and also, highlight some of the things that affect Liberians as it relates to their health and well-being. Today was a great day. I had a service and then came back at the station to do some work, prepare for tomorrow's morning news, of which I know is regular, our 6 a.m. news rather. We'll bring training issues to Liberians, inform them about what's happening, and also educate them about some of the things that are happening around them and as well in Africa and the world. So yeah, thank you, and I'm glad to be here today.
Okay, thank you very much. And James is one of our young Liberians who he's volunteering to our station. He's volunteering, and I
Wow.
admire him a lot. He love his church. Yeah, he talking about church business and sometimes joking, but he's there tonight, and he's going to sleep there. He's going to stay there to read the news tomorrow. But this is what we're talking about. He's volunteering, so he do a lot of stuff. And today
Wow.
we're using him to be part of it. So I want to say thank you again, James. And I told you guys I watch everybody and I tell the CEO what is what. So, but I'm not going to waste no time. I'm going to bring and our man himself, Christopher Kier. And welcome to the show, Brother Kier.
I think I'm muted here. How you doing, everybody?
Okay,
Great,
you are
great.
on now.
Good,
General
good.
James, how you doing? It was nice to actually meet you. I've been hearing about you.
Thank you.
I haven't met you actually. So,
Yeah, thank you to you. I'm grateful.
all right, that's it.
Okay,
Go ahead.
yeah, go ahead. Chris, I'm going to change this thing a little bit. The mic is open. I want you, if you listen to us there, tell us the entire healthcare, what is going on? What are some of your experiences? Call us. But let me say this. We were together last night. And something yesterday, something Brother Andrew is just saying. They got people who say, me, myself, and I. They got people who came up with a brilliant idea and said, I don't need you. I'm going to do it myself. I will come on radio and start yelling and start doing this because I got the money. I will spend it. And I will make my own show. I don't need nobody. I got the vision. And once you realize it, that you can come up with all the vision, but you got to bring people to realize the vision. And I will say this today, I will be honest and tell you, Kia, how you making it? Because where you got this idea from, say, listen, I will jump into this thing here no matter what, because everybody want to do business. If I'm a living witness to know how much we have spent for the one that I know on my own, I can tell people today this is what we spent and this we have not gotten anything. But to see us doing it, we were together yesterday, and every time we're together, what we discuss about the same Liberia. Nothing, all the conversation were on Liberia, planning all kinds of programs just to empower the young people. Chris, I will tell you, they tell your people, you and your wife, and you were there over there was sitting, Chris, Andrew, myself, and you guys smiling and telling us and not even complaining about what we're going to spend. Please let the people know this thing here, because how you managing it? Because I know if I can go that hard, but we prepare to work.
Yeah.
What motivating you? What every day that we get up, you say, and you this morning again you call Liberia. Yesterday, Liberia, yeah, Liberia. So just tell your people what really motivating you to really get into this thing that we're in today.
My first of all, my view has been the Liberian people. The the people that actually cannot afford a daily bread, people that live in destitute communities that want to strive but don't have the support, the financial support to be where they want to be. I'll be very honest with you. From the day we have started this journey, Mr. Kishen, you just came in the picture in the middle of it. But honestly, from my financial records, I know I have spent over close to $200,000 and counting.
Wow.
And this is financial direction I have got. I would have chosen to go another profitable route to say, well, I want to build a hotel in Liberia to be able to make money for myself and my family. But like I was telling my other brother the other day, Mr. Andrew Kia on the show, and we like this particular money that we all wishing to have,
Mhm.
we're gonna die one day living here. But at the end of it, it will be that whose life have you affected? The time God, the blessings that God have given you. What have you done with it? And so they said the Bible says, to who much is given, much is required.
Yeah.
I want to be able to do something for my country. Not so much. I mean, I don't want to say I'm rich. No, I'm not. But the little God has given me and my family, I want to be able to share, with the people back home, my Liberian people, to be able to bring put a smile on somebody's face. And, so tomorrow I can, if I'm out of here today or tomorrow, somebody can look at and say, this man is a good man. He has a good, vision for the Liberian people. So it's not so much about what is actually there for you. People ask me most of the time, like, what's in it for you? What the business is doing? What they know, like the profitable aspect of it. No. So I mean, actually here to help the Liberians, the Liberians. They are the one of which I'm, waking up every day to a new vision, to a new plans, and financial propositions in my life, and a new journey. So just to see a little bit of what you asked.
Yeah. And for those of you who listen again, Andrew, you know Chris better than me. You saw him coming up. And when you look at Chris today getting in these kind of ventures, what will come to your mind?
Well, I would say, first of all, I'm very thankful to God for him. Thankful to God for our family as well. Um, just hearing Chris out and knowing where we came from, our origin, we went through a lot of difficulties. What Chris is doing right now, I see that as a work in process or a work in progress. When you look at where we began in Liberia, where we came from also in River G, our family life, the challenges, growing up in the interior, coming to Monrovia for school, and then on to other tertiary education, and then to the US. When you have arrived at some at some level of you know some level of stability, and you look back on what others are also going through what you went through, it takes a good heart. It takes that conscience. It takes that goodwill. It takes that God-fearing heart to say, I want to share with my brother. And so hearing it out is what it brings into my mind of someone who knows where he came from, someone who knew the challenges from the back from way back to now. And this platform and this particular opportunity is not an issue of trying to boast to anyone that, oh, I have it all. No. What we're saying is being able to identify with people who are just like you and I. And that's all about success. That's all about achievement. When you can put a smile on someone's face, when you can make someone, you know, be happy, that's what we call success.
All
And
right.
to see someone doing that, I constructively envy him, and I want to also join him to do more. And all of us with what we are doing, the advocacy, sitting on the radio, spending your time, and being able to share the good news or to share hope in people. That's all that matters. Our society, it needs all of us. I want to thank Chris for what he's doing and what he's going to continue to do. And we are all here also as a partner in progress with government of Liberia. I want people to know that very clear. You in the business sector, in the private sector, you are you are just another partner to the government to making sure that all of us Liberians be able to comfortably sit tomorrow and move life ahead. And Chris is doing his part. Um, you in studio, you are doing your part. So I am not surprised, and I want to just pray for Chris further that God will give him more zeal and more vision to see exactly how we can all look back to be of help to our own people tomorrow.
Thank you again, Andrew. I want to say to those of you who are to us, politics, Chris is not interested.
And Kisha, are you there? Can you hear me?
I told him about his Wi-Fi was buffing. He needs to probably do something. I don't know what's going
Yeah.
on.
And all of these as to how Chris and others have come. They said behind every
Successful.
man who beat his chest.
Yeah,
Trust me, behind him is a beautiful, a very strong, visionary wife.
right.
And look, yesterday I was with my sister-in-law yesterday. Two gentlemen were in the house, and she prepared the two bowls that I couldn't get over with yesterday. So two of us were eating and looking at the other guy's size and looking at my side. I said, but why the two of us should have the same bowl? So I made sure he finished his, and I didn't finish mine. Wanted to prove a point. But that's what I know. That's the joke part of it. But that's the kind of sister-in-law who is
Yes,
also
I think it's
behind
from
my
my
brother,
side.
who is behind Chris, who's doing everything to getting things going. We want to thank the CEO wife, with all that is happening. We pray for you that God will continue to give you guys more vision. Kishan, it's over to you.
Yeah,
Your internet buffing, my man. You gotta do something.
this is Comcast. This
You know,
is Comcast,
Comcast does not have a good internet. You gotta go to
my
Verizon.
internet.
Verizon, my man. This is Verizon.
Go to Verizon. You want internet? You don't go to Comcast. Comcast is cable. Is like the TV is Comcast.
even like
Internet,
even
You're
Liberia is better
right.
than
internet
you.
is Verizon.
So the good thing I was listening to Andrew on my talking about our time yesterday. I was watching at the cinema, but you see the internet went off on my side. But for those of us who are listening, I was saying that this Mr. Kia is not into politics. And if Mr. Kiers want to get into politics, because the fact that we know how Liberia get to politics, they might come 2 years to the time,
Mhm.
or he himself will run his show and start showing himself. In fact, to be honest with you guys, we don't want forcing Kier to even put his picture. We don't want trying to show him to you because they live with him. He just want to do it without anything to say, any benefit to say, oh, this and this. But we don't want actually forcing it. So the line, we're going to open this line, please. Mr. Kia is into the healthcare business, but we can't tell asking questions about healthcare when he knows that the healthcare in America is good. He's not going to tell you. This is how your healthcare got to be like. This is why you're going to be like. You got to get insurance. You got to get health. No, I can. He will give you the whole lineup that listen. I got healthcare. I can walk to the hospital. Nobody refuse me. Is that how they do it to you, like bro? No. You tell us what is going on. How can we? Please don't come on and tell us, oh, you don't have a rent. There will be surprise someone today. If God will bless you, He bless. So to ask, oh, I eat today. Oh. Everybody problem, serious problem. So please let us do the best. You can ask us any question. You can ask Mr. Kia. You can ask Andrew. You can ask me any question, but any kind of idea you have. And for those of you doctors, please come in. Administrators, ministers, whatso government official, come in. You are free to come to the studio. We can be begging you now. You want us to come to your office, we'll come there. But please be a part of this thing and see how best we can help our people. We are doing everything possible. This is not politics. Like Andrew, you'll see, like Andrew work in the government. Andrew not going to criticize you. I'm not going to criticize you. We just want the best. You will never hear Mr. Kia criticizing you, but we'll criticize the system. We're not criticizing the president, but we'll criticize the system because it doesn't go right. So that is why we're having all these things to have our time on. So, Andrew, do you have anything to add on?
Well, nothing much. If our people are open to the phone, let's hear them out. Based on that, we'll be able to make more inputs.
Okay, and James, I want to open the phone line, and while the phone line is being opened, we'll get into other stuff. We are not doctors, we are not health administrators, but if I ask Mr. Andrew, when it comes to this healthcare, what you really want to see in Liberia, what your vision, what you can just come and say, "Yeah, at least I can go home now when I go to health business."
Well, I actually want to see a well structured uh, healthcare infrastructure that that will be more reliable because and then have better access to it, and not only me but for the entire country. If we will be able to have easier access to healthcare, trust me, that's also a guarantee of a healthy society that we are trying to look for. You can never have a very viable government running, even the private sector, if the healthcare sector is undermined. Definitely, you tend to also undermine your own safety. So healthcare is all it contributes to say 90% of our own well-being. If the government can invest into that, and we can all have that access to it, you have a society that will be more wishing to do a lot.
So can I announce the numbers now, Mr. Kishan?
Yeah.
Okay, those of you following through Radio Land, you can call them 0770 573 477 0881 871 670. Again, 0770 573 477 or 0881 871 670 are the numbers to call and make your contribution on the program. And you can also tell us what you know about the health system in Liberia, what are your experiences, and what would you recommend to national government to help improve the health sectors or the hospitals, the different clinics until you go to in your community or your environment, wherever you are. So I just want to share an experience on what happened during the week with a footballer, a young Liberian footballer who passed off as a result of, I think, a field system, I would say, because um, what he suffered from is something that is minor and not very, very important that anybody would think, a young person like him would die from. So he's Amara Kamara, and then uh, reports surfaced on the internet that he passed off 15 days after he sustained an injury during a match, I think on or at the D2S foot pitch. He used to play rather for a team called Black Men Warrior. And he got injured and they had a spinal cord, I think, broken. And he was taken to first, according to the story, he was taken to Redemption Hospital first, and then according to the doctors there, the beds there were insufficient, so they could not take him in, and he was rushed to GFK to seek urgent attention. Okay, I thought someone was calling in line. So he was taken to GFK, the same story, no bed, and also he was taken to the Camden Hospital, St. Joseph Camden Hospital, and they accepted him. They did the test and thing, but the doctors there recommended that he be, taken out of the country to Ghana for treatment. He needed to do a surgery on his spinal cord. The team, according to the story again, had the money to pay for whatever medical service they are supposed to provide, but they even hire a doctor, specialized doctor, to come and and treat or take care of what was happening. But then when the doctor came, he did his assessment, everything he's supposed to do. He, according to him, there was no equipment to treat or to get the job done. So imagine that. And the team had to liaise with the parents of the player young Amara Kamara, and then they initially had a plan to travel to Ghana to do the test and go through the surgeries also go through undergo and then be treated. But then unfortunately for him, he died while they were making arrangement for him to travel to hire a specialized ambulance to take him. Because according to them, a plane, someone with spinal cord cannot sit properly, so he needed to be relaxed on a bed, and then the plane they wanted to hire, according to the story, could not provide a service for him. So they thought of hiring an ambulance to take them. So, but why in that process he passed off, and there was a series of comments, views from Liberians questioning the health sector, the health system, and then some of the equipment we have here, and other things that surrounds Liberians' health. Because even these days, if you go there with a critical condition, apart from malaria and typhoid, there's a likelihood that you may not make it, or there's a likelihood that you may not survive if you don't have the grace of God upon you. And there are several cases we can point to relating to this, because it has become so glaring, and it has just validated the claims that we need a real overhaul of our health system. Apart from just sending doctors out for treatment, we also need to equip the different hospitals, provide subsidies for them. Read the budget from last year, there was an increase in the health budget, but then there's more need to be done. Imagine the 40 Meridian Hospital, not 40 Meridian Hospital, sorry, the Emirates Hospital in Babolo County still lacks medical equipment. They fail, medicine to treat patients and things. You have a very big hospital there that can cater to citizens from Great Cape Mount, Bomi, and Babolo counties, but then you do not have the equipment, you do not have sufficient medicine, you do not have even the workforce to provide the medical services to citizens. And it keeps happening over and over and again, government in, government out, and we keep experiencing the same problem. It seems like there's no way out. You just clock up in a bus where you cannot move, you cannot shake, you look left and right, there's no way out. And this is affecting most of the young Liberians who are coming up. We just witnessed a young guy who also died as a result of an error made by doctors at that same St. Joseph Catholic Hospital. So this platform, I think, is something that Liberians should embrace, because to come and speak out their minds. If these things are affecting you directly, you do not expect government to come and talk about it, because they would now want to paint themselves black. Don't expect people from America to come and talk about it, because they do not experience or they do not get firsthand, you know, on what's happening to you. You, your very self, who are in the communities, who are in the different neighborhoods, or in the different counties, districts, you are the best people to come and talk about what's affecting you as it relates to your health. Because if you don't talk about it, how does the government know, rather, what area to direct funds and things. Yeah. So I just thought to bring that up as part of the discussion here today.
That's a good point. Thank you, James. These are some of the issues we try to address actually in the healthcare system in Liberia. like the general was saying, we actually in America here we don't know what's going on in Liberia. So that's why it's very important. It's important that you guys on the ground there should be the ones calling in to tell us what's going
I,
on.
I think we have a caller here. Welcome. Your name, what did you join us from? Welcome.
My name is Steve Gordon, and I call from Central Monrovia.
Okay, go ahead, please.
Thanks for having such important program on the radio station. Yeah, I just started to the radio station a few times, because a lot of radio stations I listen to politics, which is not healthy for our system. Especially thank you for having such a program on the station. So, some of the healthcare, like, well, sometimes not, February 11th. My parents were scared. I have actually had I constructed my eyeball, built my foot from the popular, and I had two children, five of my children, this picture of the eyeball. I was taken to the hospital because they have the POP who have done the casting. I was referred to JFK. So, 40 years ago when I got a JFK, there was no there for pregnant. Imagine that I went JFK almost a month, no there, my foot. Just like that, I had to go to heaven. Up to now, I think I feel the kid joy. And I'm looking all around for a remedy. Look like you get there, something, you said I think they said one thing I read for people is we have to redirect our resources. Like what is not like before, especially in Monrovia. I'm not just saying Monrovia is not beautiful. Monrovia is very popular. Jeffrey is yelling. That's not Jeffrey was like before. And here it is that. You have to get that. You have to have book, you have book medication. Yeah, because so for me, I think we should know how to direct our budget. I'm not speaking of one government. Because it happens from government to government. Right. So for me, I think like I was changing president or changing representative. So it's about changing the policy or amending the policy into reality. That's my concern, brother.
Okay, thank you so much. Keep following.
Look it up, look it up, look it up, look it up.
Yeah, thank you very much. Listen to you, brother, and he's right. I just following. He said I just start following the station because every station I go to, all politics, and I hope everybody and that.
So
That's
So the
for
numbers to
today
call
or
are
tomorrow, but we're talking about the future.
0770573 081 0770 477 are the numbers to call and make a contribution to the program. This is Kia Radio 95.9.
Okay, you are coming in, Chris. You have something to say?
I think we have another caller here. Welcome.
Hello?
The name and what do you join us from?
Well, thank you very much. And look, God bless the care as a family, we create the care foundation and the care network. And the care videos in the government peace and gratitude into this wonderful station. What my name is Mohammed Incarnation. I am a vision impaired person. I want to say thanks to Mr. Care. The critical care, let me say thanks to you.
Where are you calling from, please?
I'm speaking to you from the project I'm in.
Okay.
I think our CEO, let God blessings, let God bring peace, and gratitude to him with whatever or goodness or things that is looking for in the world or on the earth, let God bring it to him for him and his family. I think the CEO he is for humanitarian in doing that for the like 24. I think he tried to see our best to work tears from my eyes, and that's why I called on the station. I think for me, I'm going to be a member of the foundation. I called on the platform last week, and I was opportune to reach at the stations, and I think the CEO tried to do something for me, but I just called to say thanks to him. And I know that it's going to happen because I'm a vision impaired person. What I called on, definitely, and I believe to the Almighty God that I'm serving, Definitely, the CEO going to work here from the heart. So let God bless him. Let God bless Mr. Jonathan Morba, the
Mm.
executive director of that institution. And let God bless him and let God bless all of the good staff that want
Yeah.
to care with you. May God bring peace and gratitude to your institution.
Okay,
God will never bring shame to that institution. Therefore, keep opening the virtue for that wonderful radio station.
okay, but
I will.
before we leave you, have you experienced a situation where you went to the hospital and then there's no drugs, maybe there's no bed, or have you experienced any situation? What's your own view about the healthcare system in Liberia?
Well, for me to be very honest, or for me to be what, I, I was going to the treatment. I used to take treatment for my eye before, okay, and I stopped going to the hospital for a very long period of time because let's say I was trying to go, at the SC focus clinic on 12 feet in JFK and other medical eye institutions. Yeah, but because of some financial situation, I've stopped. Yeah. But if it's because to listen in a redemption hospital where I've been starting in Butan here in Kuala here, people complain about the redemption hospital. Anytime you go there for medical treatment, you cannot be opportune to even get your pill. You go there, they always prescribe and the drug, they write it down for you to go and buy water. See me. Sometimes we go there to even get the pay is very much difficult. You have to transfer the patient to different destination or a JFK or other destination and area. Yeah, so I think even listening to the medication in care, I think it's a critical care in care to care for the young people or all of the time people listen to different radio stations, politics. For this identify radio station opening as a care network, I think it's there to care for the young people life, for the young people situation. And the following before when you even intend to give 100% of scholarship, even people meant to do that, that God bless you. They have been calling last week and I tried to cry on me for my rental situation. Now I went there and he was about to weather care on her. Let God bless him, Mr. Critical Care. See
Okay,
you.
thank you very
Keep
much.
doing a good make your good work for the rainbow and God will bring peace to you what we have across the world. Let God bless you. Thank you very much.
Thank you very much. Thank you. So again, the numbers are 0770573477, 0881871670, 0770573477, 0881871670 are the numbers to call and make your point, your contribution on the program. We are talking health care, we are talking the health system of Liberia, and we are talking situations that affect Liberians as it relates to their well-being. So yeah, you can call. General, it's up to you.
Yeah,
So
thank
they
you.
let me say,
Go, Kami.
yeah, what they call it last quarter say is a very prudent point. When it comes to politics, everybody wants to be a part of the criticism. The
Mhm.
least thing to do in Liberia is to criticize somebody. Like everybody wants to have a political platform, but no,
Mhm.
there's no solution. Everybody wants to criticize, be quick to criticize government or government officials, but
Mhm.
they have no direction. They have no plans. So I will always beg the Liberian people that we should really be patient, be patient with our government officials. I mean, we know that they are not the best, but equally so they themselves have some type of responsibilities and stuff. So we don't want to be the ones just criticizing them with no type of support. We should give them some type of support. So a lot of platforms, all they want to do is just come to criticize government officials and think that they're the best. But it's easy to be on the sideline and criticize somebody if the ball is not in your court. But when you go in that person's position, you will do worse than what they're doing. You are talking about. So just to throw a light on that, I want just Andrew, you can come in.
Yeah. Well, then I see another way as well. The forum is very, very necessary. It can come from all direction. Um, the government of Liberia, I think, is also an opportunity to lift to lift the issues and the concern so that even if the government was not concentrating in this area and putting money somewhere that that is not compared to even the health sector. Look, the health sector, you and I, no one needs to tell you the importance of it over a lot of sectors.
Right.
If I am not well today, if the conditions that should make me to be more productive are not there, there is in no way that even what the government or others want to do tomorrow will ever be done. So that's why the healthcare sector is very key. In fact, it is the engine. It is the engine to being able to see exactly how do we deal with the rest of the other issues ahead of us. So government, yes, we need to criticize, but we think this is also is a town crier that government will be able to listen, that even the private sector will also be able to listen. So it's a wake up call for all of us.
I think we
And
have another call here.
yeah,
Hello, welcome.
Hello?
Can you walk away from your monitor, please? Your feedback is bad.
hmm,
Welcome. Can you walk away from the radio, please?
You getting me now?
Yeah, it's better.
mhm.
Anima, where do you join us from?
I'm Sarah calling from Kebab.
Okay, go ahead.
Yeah, for a while I experienced, especially when I went from a cyber as a teen, I was standing after so disappointed because I saw four person using one syringe with different needs. And that's also so each person is entitled to one syringe. While seeing a children syringe, and then when another person comes for injection, they will grab that syringe and put you needle on it and share that other person. And I felt so discouraged.
Okay. All right, thank you. And keep following, please.
Yeah. So that's
Wow,
very.
you hear that?
I get it. So
that
sorry for
It
that.
that
scare you straight.
of course. And look, you won't believe the government needs to hear this. The private sector
Yeah.
needs to hear this. The community workers need to hear these things. You may think these things are not happening, but they are happening. That's a healthcare worker who just made that call.
Yeah.
Now, as much as she had a little job to do or whatever practical she was doing,
Mm-hmm.
that's someone who is about to be brought in the health sector profession
Yes.
or to practice.
Yeah.
Well, when you see these things, those are the gaps that tend to even hide the very life you try to protect. So those are gaps that the Ministry of Health needs to look at, even in their education and their training and the quality of health service delivery that needs to be done. Those are key things that they need to watch out for. So these are major concerns that we need to lift and that the government need to hear, that all of us need to guard against. That even when these things come out, those who are being treated, they can also voice out that it is not healthy for their life for what is going on in the field, so that the Ministry of Health will be able to streamline its own workforce and the health professionals that are in the field. They get trained on one thing, they're doing something different in the field as well.
All right.
This is not healthy, and it all affect the kind of challenges that the Liberian healthcare sector challenges that they are facing in the field.
Yeah, and I
See
also
why
want to
nobody,
agree.
when you go to Liberia, you don't want to take and go to the hospital at all. It took days to agree to go to the hospital, go to a clinic to for typhoid treatment because it was say, wow, I'm not taking injection on my body for I don't know how long. But the people ball these syringes, they ball them, put in the water, they ball it up and say, do those
Wow.
days. But they tell you. Right now, you go to Liberia when something happens in the hospital, I'm not even going there at all. I'd rather take my pills and then go back
Yeah.
to Ghana
Well,
Again.
whatsoever.
James was saying something.
Yeah,
Yeah,
so I was
James.
saying, yeah, yeah, much as like Mr. Andrew Kia said, right? It's not only the government that we will criticize, every time. So it goes beyond, yeah, much as we need budgetary support. Yes, I agree with that. But then, what about the schools that we have, right? The different nursing schools, the different medical schools around here. Some of the problems come from there. For
Hmm.
example, you have a particular school, maybe in an environment, they don't have the lab,
No.
they don't have equipment, they don't have the qualified, competent teachers to teach the students. Right? Why it does is that if that student come out half baked, right, not having the requisite knowledge and idea on what they are going to do. If that particular student gets into the hospital
Hmm.
without being well assessed and
Hmm.
and looked at, that student creates problem for a patient because you don't know what you're doing. You just go there on the
It's
basis
about
that
the
I'm
money.
going
It's about the money aspect.
to
Lack
fine.
of opportunity,
So
yeah.
it also with the schools that we have in the different communities because the schools should ensure that they have qualified teachers and they also have the requisite equipment and materials to teach the students because you cannot say you're a nurse, you can't give injection. Imagine common injection to even to find somebody you cannot do it.
Hmm.
It becomes a part. The government did not tell you to go to school and not know how to find injection.
Of course.
No. So the government has its own part to play, yes, but we Liberians, especially those practicing or emerging nurses and doctors, they should pay attention and they should go to schools that provides quality education. You can't go to one school that doesn't have maybe all of those things, and then yet you come and complain to the government. And also the citizens too who have maybe like who have some financial strength can open a well modernized clinic. Like a guy just opened 100-bedroom clinic along the Marshall Highway, right? That alone gives help to government. So we do not only rely on government. Yes, we agree that government has its own shortcomings, but again, if citizens are too are putting their one or two efforts, it contributes a whole lot to the
Hmm.
health system.
It's a community itself. Yeah, that's what you're
Yeah.
saying, James. It's a community. The government itself has some part to play, but the private sector has its own role to play too, as well in the healthcare community. So if we all want to see or establish this amazing healthcare utopia in Liberia, it has to be,
Total involvement.
yeah, total involvement, and not just government. The private institution itself has a part to play. So
Yes, so
that's
our
it.
national number again 0770573477. 0881 871 670 0770 0881 871 670. Our numbers to call, you can call and make a contribution here on the program. And we are talking healthcare, not the regular politics, but come and tell us what you have experienced at the hospital or clinic or somewhere when you went to get medical service in Liberia. So yeah, Mr. Kitchen, it's up to you.
Yeah, thank you, and James, and thanks for the topic again. And for those of you who are listening to us on Kia FM 95.9, please make your call. And also, you can follow us on Kia Network. Is we'll make it very short. Kia Network on Facebook. Right now, I'm watching it on YouTube, and you can also do the same thing. I know you're complaining about the data, but you can also watch it on Facebook and share it. Let other people see it. Help us share it. Let it go viral, please. And make the call. We want to hear from you. There are some interesting thing out there. We want to hear from you. We can't say it all. We notes, and then from there, at the end of the day, we'll know exactly what to do. But please, if you're a government official, come in. We're not here to criticize you again. Everybody here is have an open mind. We're not blaming you. We want to blame the public and blame ourselves because maybe we're not doing much. Maybe we're ourselves do the best possible. And sometimes you wash your hands. All these things help. Things like malaria, diarrhea, and all these little common sicknesses are not supposed to be in Liberia because are things we ourselves can work on. We have gone 1 hour so far on this show, and we want you to please call in and you don't know, maybe today will be a lucky person, you don't know, but continue to put your calls in and let us have a good show. Come in, Mr. Kier, Andrew.
Yeah. So, as I listened to James from the beginning, he summed it all. It tells me he's one of those well impacted by the situations on the ground. And he had a whole checklist of it. I was just listening to him.
Yeah,
Now, there were things that he highlighted that are those are key challenges that are currently that the health sector is currently faced with in Liberia. The issue of the human resource scarcity, especially the lack of qualified medical professional like doctors, he said, the nurses and specialists, particularly in the rural area. You can imagine what is going on in Monrovia. There were more about even the rural area. The scarcity of these human how you call these health professionals more is severely limit the kind of healthcare delivery that is really required. One of the things that I also took note of has to do with the issue of poor infrastructure. I mean, if you do not have those required healthcare facilities, how do you expect people to really be able to respond to crisis? It's going to be very difficult. The hospitals are poorly equipped. That's why wrong diagnoses are being made. And I remember some time ago, every diagnosis that was ever made was either typhoid or something else or malaria. And people just do not look beyond because the equipment are not even there to be able to diagnose, key medical challenges. So that poses a challenge to the government of Liberia with respect to poor infrastructure. One of the things I also took note of also is the issue of that limited access to healthcare. Look, it takes so difficult a time for our people to traveling from one end to the other in terms of transportation, even if there is an emergency. When do you even have even the ambulance to get people there in time? He talked about the case of the young man who died, just for simple issue, all because of that poor access to healthcare. If we have these, have all of these, how you call facilities available, definitely you'll easily respond to most of these things here than to have someone just die out of mere malaria. And these are things that I think that government should be able to invest in most of these things here. If government places more time on these things, we will limit most of the challenges that we have. Even the issue of another concern that I also noticed is this weak health system management. I mean, people do not have access. There is this. You don't have access to the disease surveillance. There's no proaction to see exactly how you monitor a particular illness to have that response system. Nothing. All of these things are missing. Like most of it are missing in Liberia. I'm not saying that government doesn't have the ability to do so, but these are things that they should be able to prioritize. When you do these things, all you are trying to do is to help your entire society to be more healthy. And I think this is where
Good evening,
the government
welcome.
needs to put its focus.
Yeah, really, yes. I was the first person that spoke concerning the subject. But I don't even know how do I get on it. Is it KIEH?
Say again.
That's why you talking about being on YouTube and Facebook. I put KIEH share network.
No, it's KEAR, Kia Communications Network. Yeah. Okay. Welcome. Okay. So just while you were talking, Mr. Andrew, and then something caught my attention. Recently, there's a report currently about a chicken pox outbreak in
Mhm.
the prison in Greenville City, there,
Yeah.
Sano County. So the AFO is currently investigating that case, and they have issued a press statement. You know, acknowledging the report and then asking Liberians to become as they have instructed their surveillance officers and things in their workers there in the county to investigate, assess the problem, and then take specimen of whatever cements and then take it back to the laboratory for testing to examine what's happening and then to come up with a probable you know uh, uh, um, conclusion on what has happened at the Greenville precinct there where about 6 inmates
Hmm.
have been affected by that reported chickenpox outbreak there. So I just want to bring that up while we discussing.
Sure, sure. I mean, that's very important. And one of the things that we should that is also of a concern to me because I work in Liberia for years. I live my life and know it. One of the things that I've also noticed is that the impact of the civil war, it left a lot on our health, our healthcare infrastructure. And I would think that after all these years of peace after the war, that's when government, in terms of funding, in terms of investment, this is where you need to know that this is where our healthcare infrastructure were. That because of war, these things happen. Now it's about time to now invest in these things. Because after the war, there's so much that has had an impact. Look at the Ebola epidemic that also left a lasting damage on our society. What is the government doing in that direction to making sure that we tend to restore our society in that direction? It takes that investment into healthcare infrastructure. If you do these things here, you are only going to be helping your society in a long way than most of the immediate things now that are now confronting you. But if we tend to put our funds where you know uh, uh, priority issues are not addressed, trust me, you are only trying to undermine your entire healthcare sector. So I'm not a health practitioner, but this is common sense that we need to know exactly where funding should be diverted so as to be able to save the society. A healthy society is a productive society. And we will not be, because if we don't do that now, we spend so much tomorrow, then even going to other neighboring countries where we have all of this that can be done right there in Liberia. I think so far that's what I want to comment on for now.
So, James, let me add this there. I think moving forward next week, what we can do we can be a help to our quarters because I learned that the meetings are too expensive for them to call. So we can do the same thing we did the last time at 20 callers, $5 each, but not the same caller calling every week. We can do we can do a repetitive we can have a repetitive callers. So we can do like the new callers. Any new caller that actually that calls in the show, 20 callers will have $5. And they can pick it up at the radio station, or we can send them the cash. What's the name? What the is that our money
Mobile money,
mobile money?
mobile money.
Yes. So moving
Yeah.
forward, and
So
we can do
uh,
that. We have more
new
callers,
callers,
new callers, not just one person calling
new
every week.
callers. If this is your first time calling,
Yes.
well, to audience, you just get yourself a tax. If this is your first time calling, and if that's your first time calling the radio station, you will get. I know people will say, "Well, I always call it. Why is that me?" Hey, listen, sometimes it work that way. If that's your first time calling, now you got to push your friend to call. So maybe your
Yeah.
friend will share it with you too. So this is your first time. Also stick to the topic. If you call and you stick to the topic, yes, that's it. We're not telling you to just call. So you got to call and give a contribution because this healthcare thing is a long thing. Until we get somebody on the show, we will talk about it. We will leave it with you. You will continue to give your contribution, and we sorry again, but thank God it's still going on live on Facebook and on YouTube. It's clear whether I'm out or not, but because I'm watching it on YouTube here right now, and it's very clear. And thanks to James for his input. And James, I've said we want you to do some other research, James. And sometimes these are some of the things you need to do in the station there. Take your camera, take your microphone, and go to the radio
Yeah. So generally, you need to actually work on your internet. That's the thing.
You way here in America, my man. The people in
To work
Liberia,
on your
they
internet.
have problem with your internet, my man.
Yes. So yeah, James. So moving forward, we have to implement that in our program moving forward next week. Okay, 20 colors. Like the new 20 callers. Now, somebody calling every week and saying, "Oh, I'm calling." So we'll have to have a log for all new callers and be, for them to receive the $5 every week. Okay. Because we want participation, want to get a
Meaningful
views,
participation.
yes, want to get your views, on healthcare, the importance of healthcare in the country. Well, first of all, from my take here will be, first of all, I got the three important points here. The first point will be government needs to take the lead, or to take the initiative of getting the country on track for us to compete with the Western world's healthcare system. In order to do so, we need to invest. We need to prioritize our healthcare system. That's the only way to do it. And the reason we're in this dire healthcare situation is because there's no system, first of all. We don't have any system in place. And secondly, there's no prioritization for our healthcare system. So money is not an issue. Well, I think because we don't know actually how to mimic the Western culture in creating the needed healthcare society for the citizenry, for the country.
Mhm.
Money is not an issue in it. I can bet my entire life money is not an issue in Liberia, but it's just the system and prioritization that is lacking. Because Andrew talked about there's no equipment needed. And, so it doesn't mean that the government does not have money to buy the modern type of
Yeah,
equipment to put in
invest
this,
into that.
yeah, JFK and all of hospitals. But we don't if there's no prioritization, there's no system. We know these things, and we leave Liberia or Monrovia, whatever, and go to seek medical attention in other nearby countries, or in the Western countries. It's not acceptable, guys. So I want for the government to actually be a part of this, and it's very crucial and paramount to what we're doing here. And it's for the people in Liberia. For me, I'm honest. I've got a good healthcare system here. Mr. Pierre does. The general also has. So you guys are the one on the ground, and you need to be a participant to this cause.
Yeah, so I will endeavor to reach out to some people, like health practitioners, to maybe have a guest next Sunday to talk about this issue. To give their own experience and what they know about our health system, what can they recommend to government. We will try to bring on somebody from the health sector to talk about this. Maybe a nurse or a doctor or somebody with some medical background. Or
Right.
even
I
if
trust you,
it's
James.
even if it's a medical student, it will be good.
Yes, I mean we
Yes,
we
yes.
ourselves here we have the ability or propensity to do a guest from here, a medical person, but it will not be a help. And they
Will
will
not
not
be
be
a help at all.
discussing. They will not be discussing anything that has to do with Liberia. So it will be the Western world. So we want somebody to come from Liberia to participate on the show. So James, yeah, that's a prudent point to make. And you
James,
guys,
take on that tax, James. Take that tax up, please.
Well, quickly too, I think the Ministry of Health is still making preparation. There will be a person from the Ministry of Health to come and lead, all of these the fears of our people. Actually, when it comes from the house's mouth, which is the Ministry of Health, and be able to clarify most of these concerns that have been raised by people and all that we've been discussing. Ali de Mount who is in the interior, or the Mount Fatu, who is way in Cape Mount, and make it very simple. Our people will understand exactly where the government is, where we're going from here. Now, mind you, all is not all right and all is not all wrong. Everything we've said is more or less the concern that people what people are going through. But if the Ministry of Health doesn't come out to clarify most of these things, it looks like the people don't care. We have not seen that this particular station is the only one that government can clarify things, or it's just another medium so that the message can get to our people as well, and
Right.
then we can all hear from them. And what the Care Foundation is also doing, or what the platform is also doing, is to be able to lift most of the issues, the challenges, and work with the government of Liberia as a partner in how do we find a way out to some of these problems.
Yeah.
We don't have all the answers, but we can only work with with the government and work with the people on the ground to know exactly what is needed and how can it be directed. That's all that we are doing.
Yeah.
At the end of the day, there will be some way forward, but we have to work together as partners.
Yeah.
Yes, and it's clear, and we have gone 1 hour 15 minutes, and we might be calling. I'm very sorry again for my internet, but thank God the show is still going smoothly because I'm watching it and listening to everything on YouTube right now, and there's no break in. James, want to say thank you, and we want you to go to either the health ministry. I know you can do that because I see some of your videos. James is a very strong and hard working kid. We live almost, in fact, we're in the same area in
I think I have
Banjul.
somebody in line.
But James, thank you again. Yeah.
Welcome.
Is there anybody on the line?
Daniel, where do you join us from?
Yeah, I'm the big person to get out of the first time. That's called my phone was taking back. I always tell you guys to ask where you guys were taking that PowerPoint to meet the relevant authorities. And I want you guys to say, I want to thank you so much for such a blessing.
Thank you.
Okay, thank you. Keep following.
Thank you very much, and keep following. And thank.
Okay. So, guys, like we said, next week we have to get.
And you heard that next week, new callers will receive
Gerald, you don't need to be talking. Just sit and listen until you face your internet.
Yeah, because he
I
can take
told
the
you
trust
that.
away.
Yeah. You can't be using Comcast on the show. Next week, you don't need to be using Comcast here. You need to get Verizon before you come on. So, James, everybody need to close now, please.
Okay. I I can I can go on now, right?
Yeah, go ahead, Mr. Kid.
I think it was a nice show. It was a very beautiful show. I want to thank James in studio. He was a one man army today, and he led the show very very well. I want to thank him for that. For our viewers, we also want to thank you, and for our government, one way or the other. I know the Ministry of Health is also listening. This particular discussion was not intended to badmouth the Ministry of Health or the government of Liberia. It's just a concern that is being lifted so that all of us can partake into it for a way forward. And I would think that efforts have also been made by the government of Liberia to addressing these issues. My advice further, I am not a medical practitioner, but I would think that efforts to be made to address most of these challenges would be like more or less utilizing the community health workers to deliver most of the basic healthcare services, especially in the remote areas of Liberia. So I would think government need to invest into community health workers programs, work with the people for basic to deliver basic healthcare services. I would think that government needs to also be able to invest into healthcare workforce development. I mean, even in here, everywhere around the world, capacity building is something that is very, very key. If people get trained, they get retrained. Trust me, especially for our healthcare professionals, through educational program, there will be so much improvement in such development that we want to see. Um, there is a need to also strengthen the healthcare infrastructure Trust me, if government, do a lot of building and renovating healthcare facilities, it will go a long way to making sure that our people meet timely medical services. So strengthening the health infrastructure is something very key. We talked about the concern about also improving the disease surveillance system. We don't have to wait until it get to the doorsteps, but government has to be very proactive in engaging these things here in terms of monitoring and evaluating, most of the diseases that are all around, so that you have informed, decision to be made in your health sector. Um, Last but not the least, there is a need to be able to work in collaboration with the international partners. When government does this, trust me, it's going to be a lot. Government cannot do it all, but you as a government has to present your case to your international partners. These concerns, because the international community is right there in like in Monrovia. All of the embassies are also near Monrovia. All of what we go through in terms of people, they are also there. So you live these concerns, and you work with the international community to making sure that your people get help, because Liberia cannot do it all by herself. If we do these things, we'll go a long way to helping our own society. I want to thank all of you who have been listening for the program, and we look forward to another edition where we have the government seated, for us to share these concerns, and even in the opposition, because you are the one to also hold the government feet to the fire. We need people from the opposition camp to come. This is not politics that we are discussing, but we are saying to be able to see the issue from two lenses, from those who are now sitting down in government or in decision making position, but you still get impacted by the concerns that we are talking about. You need to also be on the platform to discuss these things here. You be able to give your view to the government of Liberia. When we do these things here, together we will have a vibrant society. We will have a unique and healthy society that will be able to do what government wants and what the private sector wants, and all of us can be safe tomorrow. So far, that's my input, and I want to thank all of you. Thank you.
Thank you, Mr.
Okay,
Kia.
go ahead, Mr. Chris. Kia, that's close. You're closing.
I just want to add a little bit to what Andrew said. That's a very thorough and prudent point he made. We cannot do this ourselves. By ourselves, the international community needs to step in. The government needs to take the lead in order for us to have a better healthcare system that works for everybody. And nobody has to be going overseas for minor treatments and medical attentions. So we have to be proactive in our undertakings to get this to compete with the Western world. I mean, money is not an issue in Liberia. I can bet my entire life, but it's just the mismanagement and the privatization that is lacking to
Yeah.
get us to where we want to be. So government needs to take the initiative to make this country to have a better healthcare system that we can compete with the Western world. So that's just it. Thank you guys, and looking forward to us having either one or two participants on the panel next week, maybe government or private institution representative from either the hospital settings or private sector or whatever it is. But we need some diverse type of conversation taking place next week.
Yeah, thank you very much, and thanks to our audience. Next week, Sunday, same time, same station, 95.9 at 7 o'clock. If you're in America, and please share the video, Kia Network on Facebook, and subscribe on Kia Network on YouTube. Subscribe and follow us on Facebook. We appreciate you following us, because I see the numbers going up high. And the first time caller next week, something you have $5.
I'm making sure we're Comcast.
James, go ahead, close. By the time you finish closing, he's done.
There
Go
you
ahead. close. I mean,
Yeah, so
I told you next week I'm coming here with Comcast internet.
Even the people in Labrador said no.
Yeah, you got the same internet with the people in Labrador. Can you imagine?
The far more
yeah,
better.
so there's a great show, and I'm grateful to be here again, highlighting and talking about issues relating to our healthcare system, and it's a great thing. And I also hold similar views as all of you have said that the government needs to take the lead, and then the citizens, you get me?
Yeah.
Yeah,
Yeah,
we
we
got
the
it.
citizens too as well. We need to also play our part by doing those little things that matter to help keep ourselves healthy, and also contribute in a little meaningful way that we can to save our own lives first, and then help save the lives of our family and our friends, our loved ones out there. So keep following Kia 95.9. And next Sunday, we hope to bring you more interesting conversation, more interesting topic, and hope to have someone here to talk to us about their experience and what do they know from the health background or the medical background. Yeah. So thank you.
Thank you.
Thank you, guys. Thank you, James. Thank you.
Thank
Uh,
you.
yeah. See you guys next week, man.
Okay.
Be safe.
Thank you.